Ever heard of anal fistula? Sounds a bit strange, doesn't it? Well, it's a medical condition characterized by a chronic abnormal communication between the anal canal and the perianal skin. In simpler terms, an anal fistula is essentially an unwanted tunnel that forms between the inside of the anus and the skin around it. This condition often results from unresolved anal abscesses, originating from blocked anal glands that can lead to recurrent abscesses and systemic infection. So now that we know what it is, what causes an anal fistula? You may be wondering, what causes an anal fistula? It's a great question. At the heart of this issue is something called an anal abscess. This is a painful condition where a collection of pus develops near the anus, often due to a blocked anal gland. Now, when this abscess doesn't heal or is not treated properly, it can lead to an anal fistula. Imagine a tunnel, if you will. One end is connected to the inside of your anal canal, and the other end opens onto your skin surrounding the anus. That's what an anal fistula is like, an abnormal tunnel-like passageway. This is a chronic condition, which means it can persist for a long time or even a lifetime if not properly treated. Blocked anal glands are a common culprit in the development of fistulas. These glands can get blocked due to various reasons, such as constipation, diarrhea, or inflammation of the intestinal lining. When a gland is blocked, it can lead to an abscess, which, if unresolved, paves the way for a fistula. This fistula can then result in recurrent abscesses and even systemic infection, meaning the infection can spread throughout your body. Now, let's talk about who's more likely to develop an anal fistula. The incidence of anal fistulas is generally higher in males, and interestingly, it's not something that just affects the elderly or the very young. The condition most frequently occurs in patients in their 30s and 40s. So, it's important to realize that anal fistulas are not just a simple inconvenience. They are a serious health issue that requires proper medical attention, and they can affect anyone, regardless of age or gender. Now we know about the causes, but how can one identify an anal fistula? Identifying an anal fistula might seem complicated, but medical professionals have it covered. To diagnose an anal fistula, doctors typically conduct a thorough examination, which could include a physical check, a proctoscopy, or an endoanal ultrasound. Advanced imaging techniques, such as MRI or CT scans, may also be utilized for a more detailed view. The diagnosis process is not just about confirming the presence of a fistula. It also helps classify the fistula into one of 5 types, each determined by its relationship with the sphincter muscles. The types are intersphincteric, transsphincteric, suprasphincteric, extrasphincteric, and submucosal. This classification is crucial as it guides the subsequent treatment plan. In some cases, the fistula might not be immediately visible, or it might be complex in nature. In these scenarios, further tests may be required to accurately pinpoint the fistula's internal opening and its path. This detailed diagnosis is essential to ensure effective treatment and minimize potential complications. So, after diagnosis, what's next? Treatment, of course. Treatment of an anal fistula is crucial to prevent further complications. Let's delve into the approaches used to manage this condition. Surgical intervention is often the primary course of treatment. The goal? To allow drainage and prevent infection, thereby stopping recurrence. A specific technique used is the VAFT procedure, a 2-phase surgical approach. The first phase involves locating the internal opening of the fistula. Once found, the second phase is initiated, which involves sealing the fistula tract. This method has proven effective in many cases. In addition to surgery, antibiotics and setons play a significant role. Antibiotics are used to clear up any existing infections, while setons, a type of surgical thread, are inserted into the fistula to keep it open and allow it to drain. This helps prevent further abscess formation. It's important to remember that each patient is unique, and so is their treatment plan. The complexity of the treatment can seem daunting, but with the right medical care, it's manageable. Treatment sure seems complex, doesn't it? But with the right medical care, it's manageable. Now let's summarize what we've learned. Anal fistula, a medical condition that's more common than you might think. This chronic abnormality often results from unresolved anal abscesses originating from blocked anal glands. It's typically diagnosed through examination and imaging techniques, and treatment is primarily surgical. The VAFT procedure is a two-phase surgical approach that involves locating the internal opening and sealing the fistula tract. Remember, definitive treatment aims to stop recurrence but can be challenging due to the risk of continence impairment. That's it for today's topic. If you found this information helpful, please subscribe and hit the bell for more health-related content. Stay informed, stay healthy,